You feel inflamed, bloated, or tired, or stuck with stubborn weight, what you call unwanted weight gain? Do you have an autoimmune condition such as celiac or Hashimoto's disease that would lead to hypothyroidism or multiple sclerosis, dementia, Parkinsonism, or maybe your family members or friends has it? Have you ever wondered why stress hits your digestion first? Do you know that stress is a big factor in the maintenance of your microbiome that also is related to your overall health? If you answered yes to these questions, most likely you have problems with your gut, dysbiosis or imbalance of your good and bad bacteria, and most likely you have a leaky gut. Today we're going to talk about why gut matters to almost every system in the body, from the tip of your toe, how the microbiome is linked to mental health, metabolism, and even skin conditions. A simple 4 protocol to support gut healing without extreme diets or gimmicks will be discussed. If you like this video, please press the like button right now so that you can help us develop the platform in a way that we can help you make you healthy. This is Dr. Raul Inad from Cadenza Medical Clinic, Ave Maria, Florida. So let's begin. So what is gut microbiome? This is just the good bacteria, about trillions of them, that interacts with the virus, the fungus, and the bacteria. It stretches from the small intestine in the duodenum all the way down to the ileum, to the colon, and down there to the rectum. They help digest food, produce vitamins, regulate inflammation, train your immune system, communicate with your brain via the gut-brain axis, and also affects the immune system, the gut-immune-brain connection. So imagine this, 70% of your immune system lives in your gut. Around 90% of serotonin, the same serotonin neurotransmitter that makes you happy, a key mood chemical, is produced there in the gut. So when gut balance is off, the effects go beyond digestion, to the brain, a distant site, and even to the skin. So let's talk about why this is important. How does it affect the health? The gut bacteria produce neurotransmitters like GABA and serotonin. They also produce short-chain fatty acids that calms the inflammation, especially the butyrate. It signals through the vagus nerve, which in essence also is the nerve supply of the autonomic nervous system, where it is divided into sympathetic and parasympathetic. Sympathetic, as you know, is fight, flight, and parasympathetic is when you're resting and digesting. There are certain types of bacteria that grows either when you're calm or when you're in fight-flight mode. This is why chronic gut issues often coexist with anxiety, depression, and brain fog. So stick with us. We're going to discuss more. Your gut doesn't just react to stress, it can create it. Stress has a very important link to the microbiota, the population of the microbiome. In fact, if you're chronically stressed, there are certain types of bad bacteria that overwhelms the system and moreover produces more anxiety and depression. So let's talk about the microbiome, or the mucin layer of the intestine is disrupted. The bad bacteria comes in to the intestine and goes into the circulation to the blood. So namely, most common, the disruptors. These are the emulsifiers. And where are they found? Ice cream, even in protein shakes. They're called polyphosphate and carboxymethylcellulose. Included in the list are the non-caloric sugar, or the substitute, especially aspartame. They kill the microbiome, the good microbiome. The polysorbate 80 that is in the ice cream also destroys the microbiome. Even the medications like the statin that helps you with that lowers the cholesterol, but I'm not so sure if it will help. NSAIDs for common aches like ibuprofen, naproxen, or aspirin. Antacids like Pepcid, H2 blockers, and PPI, or proton pump inhibitor, very strong antacid. These disrupt the microbiome. Sugar in itself also does it. Chronic stress disrupts microbiome, as I told you a while ago. So when this mucin layer is disrupted, it allows the entry of foreign proteins, and let's start with wheat. The gliadin protein in the wheat. It is the main culprit of celiac disease. So what happens? There's a gap in the mucin layer, and it allows entry of everything there is there found in the surface. The entry of this foreign protein is, for example, the gliadin, provokes the lymphocytes to produce antibody to this. When there's antigen-antibody complex, there is homing to the tissue. and in particular thing, it goes to the intestine, to the colon, to produce celiac. It is a debilitating disease with a long latency period, and you might not have the profound symptom of celiac disease of rectal bleeding that comes in late. You might have celiac disease early on, even in your teens, and you probably would never have detected it. Only an astute physician who knows to analyze these things would probably be able to lead you with this. What about Hashimoto's syndrome or Hashimoto's disease? It is believed that the protein of the thyroglobulin is mimicked by this bacteria called Yersinia that enters into the leaky gut and is seen by the lymphocytes in the circulation and produces antibody to the thyroglobulin. That's why you have this anti-thyroglobulin antibody, which is one of the markers for Hashimoto's disease. Now, Hashimoto's disease is not in itself a problem. It is when it gets worse and destroys the thyroid tissue to produce hypothyroidism, which is manifested by fatigue, unwanted weight gain, and cold intolerance, and many other symptoms that are not pleasant. It leads you also to metabolic syndrome, which is obesity, high blood pressure, and diabetes. Remember that the microbiome affects the blood sugar regulation. It affects insulin sensitivity. It affects fat storage and appetite. In another paper, anti-obesity effect of Lactobacillus gasseri BNR17 in high sucrose diet-induced mice, they have demonstrated that anti-obesity actions of L. gasseri BNR17 can be attributed to elevation of expression of fatty acid oxidation, related genes, and reduced levels of leptin. Additionally suggested that the anti-diabetes activity of L. gasseri may be due to elevated GLUT4 and reduced insulin levels. This paper elucidates the effect of metabolism in certain bacteria like Lactobacillus gasseri. Lactobacillus gasseri has also been found in a study in humans where without diet, exercise, Lactobacillus gasseri demonstrated to reduce the visceral fat. So it's a good tool to help you with the metabolic syndrome, which is highlighted by increased visceral fat or increased waistline. So to continue with the autoimmune disease, Hashimoto's thyroiditis, as I explained, and celiac disease from the gliadin protein, rheumatoid arthritis, one of the autoimmune disease, is also related to some bacteria. For example, Porphyromonas bacteria, a bad bacteria, is noted to travel to the synovial fluid and cause citrullinization, causing crystals there. Colinzella, which also is a bacteria that is associated with rheumatoid arthritis, is noted to promote citrullination of proteins, thus precipitating in the joints. Studies have also shown that certain bacteria grow and predominate in patients with multiple sclerosis and Parkinson's disease. And in particular, Parkinson's disease, it has been demonstrated that gut years before neurologic symptoms appear, early changes in the gut bacteria already occur, and even altered gut motility. Certain bacteria produces serotonin. Serotonin is needed for the peristalsis. So if you don't have that good bacteria to produce serotonin and also make you feel happy, there will be problems with the gut motility. So remember, inflammation travels from the gut to the brain, and it also affects the immune system. So what about nourishing our gut? How do we do that? Number one, remove the disruptors. First, fast on sugar, even the non-caloric sweeteners like aspartame. Second, feed the microbiome. Fiber, vegetables, for example, is not needed by you. Of course, there's a micronutrients there. However, the gut microbiome ferments this fiber to produce short-chain fatty acids that's needed to decrease the inflammation and also to heal the gut, especially the butyrate. There are 3 short-chain fatty acids been studied: acetate, butyrate, and propionate. Without the fiber, these gut microbiome will not survive. In fact, certain microbiome will start eating the mucin layer of your intestine, clears up some space, and opens up the gap to call this leaky gut, and gets into the immune system and is reacted and to produce antibody to produce the autoimmune problems like Hashimoto's and celiac disease. What about fasting? As I told you, fasting will increase sensitivity of insulin sensitivity. Fasting also decreases inflammation. It also reverts the sympathetic tone to parasympathetic tone, which favors the flourishing of the microbiome. What about exercise? Exercise is friendly to the microbiome indirectly, because when you exercise, there's a proliferation of good bacteria that feeds each other. If you don't exercise, there's predominance of bad bacteria that leads to metabolic syndrome, increased appetite for hedonic appetite for sweet and salty food, or what you call the junk food. So all these are related. Lastly, meditation. Meditation calms the brain. However, it's related to the gut. When you meditate, there's a proliferation of good bacteria that favors good metabolism, that favors decreased inflammation. Meditation using the unconditional love of Jesus through his passion is very effective. Guided breathing with 4 counts, hold 4, exhale 8, hold 4. Repeat this at least 25 counts first thing in the morning. And in the afternoon, maybe repeat this again with the same breathing exercises together with your devotion for divine mercy. For example, when you inhale, you say, "For the sake of your sorrowful passion, hold, exhale, have mercy on us, on the whole world," and so on. Meditation is also contemplative rosary. Contemplative rosary is another form of a tool where you can use as meditation. It's comparable to the Eastern meditation where they're using the beads and their hands doing this tap, or using the mantra. Well, we have our own mantra. Hail Mary, full of grace. The Lord is with thee. Blessed art thou among women, and blessed is the fruit of your womb, Jesus. And so on. The movement of your finger on the rosary bead, and you focus on it, helps you meditate and helps you elevate your good bacteria, flourish them, switches the sympathetic tone to parasympathetic tone. So it's an amazing event, an amazing correlation of all these things: diet, fasting, fiber, exercise, meditation. So if you like this video, please make a comment, share, so that we can help other people too. Maybe it would be your friend or your family. In the next video, we'll be talking about more on medicine and faith. This will help you have a comprehensive approach to medicine. This is Dr. Raul Inad from Cadenza Medical Clinic, Ave Maria, Florida. Thank you.